Good afternoon, everyone. Good afternoon, everyone. Welcome to 3L, Long-Term Care Lunch and Learn, hosted by Legal Aid's Long-Term Care Ombudsman Program. My name is Angela Zeke, and I'm today's moderator. Today's presentation is being recorded in audio format only. The audio recording will be placed on our website, which is www.lablaw.org/LTC-program. All lines have been muted at this time. If you have any questions for our speakers, please use the chat feature located on the right side of your screen if you're joining us online. If you're joining us by phone only, you can submit your questions by email. You can email ltcombudsman@lablaw.org, ltcombudsman@lablaw.org. We will try to answer all questions today. If we cannot, we will respond to your email, or you can contact us directly by phone. With that, let's get started. Today's speakers are Amanda Hamilton and Wayne Ann Cottle, Ombudsman for the 5 and Gateway regions that consist of the following 10 Kentucky counties: Bath, Boyd, Carter, Elliott, Greenup, Menifee, Montgomery, Morgan, Lawrence, and Round County. Wayne Ann, we are living through some unprecedented times right now. It seems pretty scary out there, and I know a lot of our long-term care families are feeling uneasy. What can we say to them that can ease their fears during this time?
Hi, Angela. Hi, everybody. You're exactly right. We are in unusual territory, and we're really having to learn to navigate this new environment. All right. I'm getting some feedback. You all hear me okay, Angela? Can you hear me, Angela?
I can hear you just fine, Wayne Ann.
Oh, fantastic. Okay, like I was saying, we're really in uncharted territory right now. Even for our program, it's a challenging time. And so it's really important to remember that any challenge we've got is nothing compared to the challenges that families are going through right now. But it's also important to keep in mind that we are resident advocates, so we push forward. We're here to help families and their loved ones, and we're doing our best right now to keep up with new information that comes out. It seems like it's coming out by the hour at this time. We know that one of the things that's been so hard lately is the visitation restrictions. For our residents, communication with loved ones, it's a vital link to the outside world. This is true even without a global coronavirus pandemic, but it's even more important now. Right now, we know that residents are missing visitors. They're also missing activities. it's important to remember that group activities within the facilities, they're limited too. So residents are missing all those fun times with the friends they have in the facility as well. I'm sure the days get really long sometimes. And for residents who become confused or have dementia, this can be even more worrying. Regular communication with loved ones provides stability and comfort and a lifeline to the present. And without that, the world can seem really scary and unfamiliar. Next slide.
I see that we have some new folks that have joined us. I just wanted to remind everyone that you can submit your question through our chat feature, or you can email your question to ltcombudsman@lablaw.org. Now, I see that, Amanda, that we probably are getting some calls about communication needs for our families and our long-term care residents. Can you give us a little bit more information about who really ensures the right to communication for our long-term residents?
Yes, Angela. So we as ombudsmen work to make sure that all resident rights are protected, including the resident's right to communication. In addition to ombudsman, the Office of the Inspector General, which is the licensing agency for long-term care facilities, has nursing home surveyors who perform routine inspections and they investigate complaints. They make sure facilities are following the rules outlined in nursing home regulations. The regulations are derived from the federal law, which provides protections of resident rights. Resident rights are so important because when someone moves into the nursing home, that doesn't mean that they lose the rights they had at home. The Office of the Inspector General does their investigation based on F-tags that come from the federal law. Next slide, please. So the resident rights we're focusing on today is communication, which is covered in F-tag 576. And this states that residents have the right to access a telephone with reasonable access. So telephones, computers, and other communication devices should be reasonably acceptable to residents and adapted to accommodate their needs and abilities, such as if someone has hearing loss. The facility must protect the resident's right to communicate with individuals and entities within and outside the facility, including a telephone with TTY or TDD services, the internet to the extent which it's available to the facility, and they should be providing residents with stationery, writing implements, and assisting them with mailing if they want to send a good old letter to their families. But another important aspect of communication is privacy. This includes privacy with electronic communication. Residents have the right to make calls in a place where they cannot be overheard. So only allowing residents to make calls from the nurse's station is not appropriate because it's not only not accessible to residents with mobility concerns or any other reason they can't come to the nurse's station, but it's not appropriate because there's no privacy. You know, anybody walking by can hear their conversation or anybody sitting at the desk. And using a phone in a staff office also does not meet the provision of privacy. Examples of things that are acceptable would be providing a cordless phone that can be taken to the resident's room and having a telephone jack in the resident's room so they can bring in their own phone if they choose. Residents have a right to reasonable access and privacy in the use of electronic communication, such as email and video communication and internet searches. So this means, you know, I know a lot of residents are FaceTiming right now, and they should have the privacy to be able to still have these private conversations with their family, even though they're doing it in an untraditional way. Next slide, please.
Well, that's all really good information, Amanda. And I know that communication is definitely a concern outside of a pandemic, but really is something that, like I said earlier, that we're getting lots of calls about currently. So, Wayne Ann, can you give us some suggestions that you've been given to family members and to facilities that can help them during this time navigate communication difficulties?
Yeah, absolutely. And communication can mean so many things these days. We can communicate in ways that people never would have thought of even 10 years ago. Obviously, the simplest way to communicate is, if residents have their own phones, they can get calls anytime, whether that's a cell phone or their own personal landline phone that they have in their rooms. And it's important to remember, if you are a long-term care resident in a personal care home or a nursing facility and you're on Medicaid, there are programs available to provide you a free cell phone with a certain amount of minutes per month. So you can reach out to the Ombudsman program and we can put you in touch with that information if you need more information. If a resident doesn't have a phone, loved ones can always call the nursing home and staff can take a cordless phone to the room. Like Amanda said, those calls should not be screened. You shouldn't be asked who you are or why you're calling, unless there's, the case where the resident has asked for those calls to be screened. But most of the time, I've never had that happen. You can also do video calls over FaceTime or Skype or countless other applications. Most facilities have purchased tablets in the last few weeks to help residents communicate with their families. Residents can also email. If they don't already have an email address, staff can help them to set up one for free. There's so many options for that. And don't forget letters. The written word never goes out of style, and facilities will supply paper and stamps for you and make sure it gets out in the mail. Lastly, the one you're seeing in the news all the time these days, you can call your loved one and talk to them while you sit outside their window. So you can see their wonderful face. We have some facilities with all the resident rooms on the second floor. And what they do is they just make arrangements for residents to be in the front of the building, in front of the big front windows at a certain time, and they have their conversations then. There really aren't many situations that can't be accommodated. It just might take a little creative thinking. Next slide.
So now we're going to take your questions, and just as a reminder, you can submit your question through our chat feature if you are joining us online, but if you're calling in only, you can certainly submit your question by email to ltcombudsman@lablaw.org. That is LTC OMBUDSMAN@lablaw.org. And we have received some questions that have come in both by chat and by email. And the first one reads, is the facility required to give the resident a phone for their room? And are they required to fix the phone if it is damaged? Amanda, would you like to answer that question?
Yes, Angela. So A facility would not be required to provide a phone for every resident in their personal room. Families can bring those in if they choose, if they want to bring a phone from the resident's home, but that is not something that's required to bring by the facility. Now, the facility has to have some way that they can communicate. So they do need to have a cordless phone that they can take to the resident's room, or I know some facilities have like a cell phone that they take to resident's room, but there has to be some kind of private conversation available, but they don't have to provide that phone. Now, if the phone would become damaged, the way the regulation reads, the facility wouldn't be required to replace it unless it was proven that it was the facility's fault that it was broken. If some way, they dropped it or knocked it off the stand, but it would require it being proved that it was a facility's fault.
Thank you, Amanda. The next question comes from chat, and it says, who do I call when I'm denied the ability to talk to my dad? Wayne-Ann, can you answer that for us?
Sure. You would need to know the situation. There are cases when resident communications can be restricted. I'm thinking primarily of legal guardianship. Depending on the type of guardianship, a guardian could restrict communication. But outside of that, there really shouldn't be an attempt to stop you from talking to your loved one. If this happens, I always suggest taking your concerns to someone at the facility first. If there's a staff member, it may be a social worker. A lot of times, that's kind of the frontline communication with families is from the social worker. But someone in the facility that you have a good relationship with, that you've worked with before. If that's not the case, you don't have that person to fall back on, I always recommend talking to the administrator and explaining what's been happening. If after all those steps you still have concerns or questions, you are always free to call your ombudsman.
Thank you, Wayne-Ann. We actually have a couple more questions here that we received by email. The question is, can a facility limit the amount of time a resident gets to use the phone? Amanda, would you like to?
Sure, Angela. So I am sure that this is probably something that is on everyone's mind right now, because there's so many people wanting to use the phone because that's their only link to the outside world. And I'm sure that there are, a lot of conversations going on, but the facility shouldn't be limiting the time you're able to communicate. And I know it's difficult, but when the residents want to speak to their families, they should have the ability to talk to them as long as they want. If this is becoming an issue, facilities should look at purchasing more devices or what they can do to give residents an adequate amount of time. With resident rights, we look at it as what you would be able to do in your own home. So when I'm speaking to someone in my own home, if I'm calling my family, I always have the ability to speak to them as long as I want. So our residents should have the same right, anytime, but especially in a time like this when their communication is so limited.
That's good information to have for sure. There's another question that concerns maybe some privacy issues, it appears. Wayne-Ann, the question reads, my mom told me that a staff person stayed in her room when I called her the other day. Can they do that?
We have dealt with this a few times in the last few weeks. And we've encountered the situation for several reasons, but most stem from one thing, and I'll get to that. But the simple answer is, ask politely for privacy, and that should be given to you. Can they do that? No, not really. We've talked to lots of folks who've dealt with this, and I think that one thing I talked about is it's coming from the fact that residents need help using the phones and tablets. Some of this new communication can be really intimidating to our residents, but that's a pretty easy problem to solve. The facility can type up a step-by-step guide to using whatever device it is, whether it's a cell phone or whether it's a tablet or a laptop for that matter. Something probably with visual cues and pictures is probably the best idea. We know another problem is that some residents have a hard time holding the devices. But there are many, many tools available to help the devices stand up on the residents' rolling tables that can be positioned right in front of them, and the tablets or the phone can be just propped up right in front of them. And then when they're done talking, they can press the call light to let staff know to come get the device because they're finished. Once those accommodations are made, calls should be time limited. So there really shouldn't be any reason why anyone needs to monitor your communications. There shouldn't be anybody hanging out in your room in order to time your call or tell you, oh, it's time for the next person. That shouldn't really be happening. Like I said in my other question, if you still have concerns, always reach out to the Ombudsman. We're here to help you with just this sort of thing.
All right. We have received another question, and it is one a very difficult situation for any family to be in at this time with us handling this pandemic. But the question reads, I heard that if someone is at the end of life, that family gets to visit. My father is on hospice, but I haven't been able to visit. I don't understand. Wayne, can you kind of shed some light on what this family member needs to know about the new process here throughout the pandemic?
Yeah, this is a delicate subject. The time when a resident approaches this stage is emotional, it's stressful, and the biggest question that we've been having is very similar to this, but it's what does end of life mean? And there was a lot of talk of that and about that when this whole thing started. There's been some guidance put out that helps define that a little bit. The first thing we want to keep in mind is that hospice does not necessarily mean end of life. At least not imminent end of life. A resident can receive hospice services for many weeks to many months. And in fact, one of the things we always try to educate people about is getting hospice involved very early allows residents to get the greatest benefits from the program. So what does it mean then? We know, you got to understand, each person, every situation is different. Not all circumstances are going to be the same, so you can't just make a hard and fast black and white rule that this is always going to be the case. So guidance tells us that the decision should be made by a team, and that team should include first and foremost the resident's attending physician, or sometimes it's a physician assistant, or sometimes it's a nurse practitioner. And then the rest of the team should be made up by kind of the facility caregiving team, the folks there in the facility who care for the resident every day. They're very familiar with the resident. And the guidance does say, though, don't wait until what they call active dying, all right? Like this is going to happen in, a couple of hours to make that call. The determination, they specifically say, should be made up to a week in advance if possible, or whenever there's a substantial change, because we know that sometimes these things do happen quickly and unexpectedly. I do want to point out one thing though. We're probably not talking about great numbers of folks coming in to see the resident, okay? You know, most of the time, I think we should expect that it would be only very immediate family, you know, a spouse, children, parents if they're still alive. And very important, anyone with a fever or showing symptoms of a respiratory illness will not be permitted in for this end-of-life visitation. And then, you know, families should also expect to be asked to wear masks, gloves, maybe even a gown at all times. And what we're finding is it's very likely that residents will be possibly moved to a different room in the facility in order to have these visits. Most facilities have designated areas where there's a very close entrance and exit in order to keep visitors from having to walk through large parts of the building. So just some things to keep in mind. But that team is really the one who's making that decision, and they should be informing the family of that.
That's good information to know, Wayne Ann. Thank you very much for giving us that information. And Amanda, thank you as well. I want to thank, on behalf of Legal Aid of the Bluegrass and our two ombudsmen, Wayne Ann and Amanda, for you joining us today for our first 3L program that discussed communication concerns during this pandemic. If we could not get to your question, I think we got to everyone on the chat, but if you send us an email and we haven't received it yet and have not answered it, we apologize, but we will follow up with you by email. Again, if you would like to submit a question after today's call, you're certainly welcome to do so by sending an email to ltcombudsman@lablaw.org. You can contact Wayne Ann and Amanda directly. Wayne Ann's phone number is 606-755-0006. Amanda's phone number is 606-780-2258. Again, you're welcome to submit any questions that you have or requests for assistance by email at ltcombudsman@lablaw.org or reach out to Wayne Ann and Amanda. And again, Wayne Ann's phone number is 606-755-0006 and Amanda is 606-780-2258. We hope that you join us again next week on April 29th at noon for our next session of the 3L program, where we're going to discuss getting good care, especially during this period of time. We thank you again for joining us, and if you would like to, for those of you that joined us a little bit later, go back and hear the start of the program. The audio portion will be uploaded to our website, which is www.lablaw.org/LTCO-program. Again, www.lablaw.org/LTCO-program. Thank you very much. Each of you, please stay healthy during this time, and we look forward to you joining us next week. Thank you.